Friends, good evening. This is Dr. Sudip Chowdhury. I'm a senior consultant in pediatrics at Asia Hospitals and also new medical clinics in DLFPs for Gurgaon. Today I have been tasked with an important topic. The topic is what happens if I get a COVID infection in between my vaccination doses. Now, this is even more important these days with government recently tweaking the time period between the two vaccination doses from 4 weeks to 12 weeks, which leaves a huge gap. And whenever there is time, there is chances of you catching an infection. Now, coming back to the question, what happens if you contract COVID-19 infection in between your vaccination doses? So let me remind you that despite getting two vaccine coverages, people are not 100% safe. Vaccination only gives you or confers a level immunity, which is around 70 to 80%, but doesn't ever give you 100% protection against any disease. It happens across the spectrum for all vaccines, not alone coronavirus, any vaccine in this world. So vaccination and immunity is completely dependent on your body. How well your body takes the vaccine, how well your body is capable of mounting an antibody response to the virus or the bacteria, and all those things which come along with it. Now, whenever a person who has got even one vaccination gets an infection, it's called as a breakthrough infection. Okay. So a breakthrough infection generally as per literature is milder to a normal infection. Having said that, whenever you get one dose of vaccine, the chances of you getting an infection is obviously more than when you have completed your 2 doses of vaccine as of now. That's what the recent study says. Now, going by the plans which the government has of giving you at least 3 months or 12 weeks of a time period between the two vaccines, the study which was published in Lancet was about a greater antibody response if you postpone the vaccination by 12 weeks. So I completely get the entire idea with which the government is working on it. It's not simply vaccine shortage, which many in the WhatsApp university are forwarding, so don't go by those information. That's wrong information. There's nothing to do with vaccine shortage with being at 12 weeks. There's the complex scientific concept which was published in the Lancet journal, and I think that's what the government is working on. Now, with obviously the alarming rise of caseload, you're worried that you may get an infection and you may get a breakthrough infection, so what do you do? So if you do get an infection, just treat it as an infection. If it's mild, it's great, it's good for you. You take your normal doctor's appointment, you talk to the doctor, you get the infection treated first. I think for any infection, the idea should be first to get out of the infection first and then obviously go for the vaccination in the next stage. Now, what is very important here is I'm going to talk to you about a recent study which was by the Public Health England, which talks about the amount of protection you get after the first dose of vaccine. Now, this new study, I'm reading from the net actually, but the Public Health England highlights that vaccinated individuals are less likely to transmit the infection to others after the first dose. Now, this study was working with 2 vaccines, the Oxford-AstraZeneca vaccine, which is available in India under the name Covishield, and obviously the Pfizer vaccine. Now, the team found that these individuals were 38 to 49% less likely to transmit the disease to the people living in the surroundings, especially homes, as compared to unvaccinated people. It was noted that the vaccine started working just 14 days after getting the shots and generated similar level of protection irrespective of age. Now, this is very important, the reason why I quoted this journal. So this only actually helps us in understanding the concept about getting the infection in the first dose. Though you may get the infection, chances are less, and obviously it may be a milder infection. So that's the breakthrough infection all about. Now, coming back to what we are talking about, so the entire concept about having this infection post the first dose vaccination rests on this idea that you are not fully yet vaccinated. After full vaccination, like 2 doses of vaccination, AstraZeneca says that you are 60 to 70% covered against this new coronavirus variant, whatever it is. So friends, I think that answers some of your questions. So if you get infected, treat it as an infection. If it's mild, it's good. If you have any considerable symptoms, talk to your doctor. It has happened. There are many doctors who had 2 doses of vaccine and still they landed up in the ICUs, and some have sadly passed away. So take full protection, be safe, and obviously be positive and be happy. Thank you very much.